Hi, this is Tom Anderson of the Steadman Hawkins Clinic of the Carolinas, and we're going to discuss turf toe. Turf toe is an interesting sounding injury. It sounds like it'd be quite minimal, but indeed it can be quite disabling. It can affect athletes and non-athletes. The anatomy of the big toe is a lot more complex than one might think, and if you look at the portion of the slide on the left side, the toe would be pointing to your left, and the bottom and top would be corresponding. But you can see at that joint there's quite a bit of anatomy that occurs with both the joint, the tendons, and the ligaments, and the small bones that you see underneath. One is labeled medial sesamoid, or SES. If you look at the picture on the right, it's a cross-sectional picture. In other words, 90 degrees to the one on the left, and you can see again the anatomy and how complex the different injuries are. And when we talk about turf toe, we're talking about injuries that occur on the bottom surface that we call plantar, but at the bottom surface of the toe. And this is a look from the bottom up. And you can see the dense tissue there that's in the center portion. And that's a real thick ligament that we call a plantar plate, which is really at the root of the injury for a turf toe. Well, these have a pretty unique way in that they happen. And if you look at these two pictures, you'll see on the left side the person's foot is somewhat planted. The toe is being pushed upward and the foot gets a load on it. And this would occur when a football player is being tackled, or possibly when a worker is trying to push something and a load hits the back of the heel. And it puts excessive pressure on the bottom part of the big toe. And you'll see from the sunburst pattern there that's where the injury has occurred, and it's tearing that structure that we looked at before on the previous slide. The picture on the right just shows from a different angle, with the toe going towards your left, another picture, and you can see that bottom arrow is pointing to where the tear has occurred in that plantar plate. Well, it's called turf toe because a lot of it was seen during the time of AstroTurf, with sort of an unyielding sod where people's feet would be planted and wouldn't have the ability to pivot out of the way when this load was added. And you'll see how it can happen with the shoe wear on the right-hand side. And you can see that the stiffer the shoe, the less likely for this to occur. And here's just a picture of some football players. Again, if you look at the foot, you can see how easy that would be for that to occur. And here's some actual pictures from the NFL. And you can see that the fellow's got his back to the play, he's blocking, he's got his foot planted, and then number 60 there on the right side falls on it, gives it that load on his foot that's got the toe flexed upward. And that's where that injury occurs. Now, most NFL teams and college teams have their linemen in really stiff shoes to prevent this injury, but you can still see with the large size of these athletes that this could still occur. This slide shows on the bottom what it looks like when someone has this injury. You see the swelling and the redness and just the overall uncomfortable appearance to that big toe. We grade these in 3 ways, and you see those Roman numerals there. And basically, this is just something that helps us in the treatment. And the first one, or the lowest grade, is a grade 1, and that's just a stretch that usually will get better without any type of surgical intervention and with just proper shoe wear and some splinting. 2 has a partial tear, and that can usually also be treated non-operatively. And then 3, the structure is completely torn, and the way it separates, it really will not heal back normally. That's an X-ray showing this phenomenon. It's a little bit blurry, but I think you can see how far that toe is being pushed upward. This is an MRI of the injury, and the arrow is pointing to the plantar plate, and you can see how that has torn. Now that end that it's pointing to should go all the way up to the next bone where you see that black tissue. So you can see that it's not only torn but pulled away quite a bit. Now, this affects the stability of that joint. Now, when this person goes to push off, their toe will actually slide upward through that joint, and they won't have any power or stability to push off when they're walking, climbing, or running. So the treatments for the grade 1, or the ones that are just stretched, is the classic RICE, which is rest, ice, compression, and elevation. The next thing you see there is a common initials that we use for aspirin-like products, which are anti-inflammatory medicines. Taping, or toe plate, and by a toe plate, that is a rigid piece of a carbon-type fiber that sits in the shoe and does not allow the toe to be pushed upward. And if their symptoms are pretty well controlled, they can return to activities as long as they're protected. The grade 2, as you see, is controversial, and you would certainly try to treat them non-surgically, and if they fail, then they might then become a surgical candidate. Grade 3 does require surgery, and we'll talk about that a little bit more in detail. Here are some of the inserts and splinting materials that you can use for the toe, and you can see they're all designed to prevent that toe from being pushed upward. This is an operative picture which shows the big toe. As you can see, the tip of it would be up to the upper left, and then the foot would be going down to the bottom right. Now that actually in the center there is the bone, the metatarsal bone, and you can see in the bottom portion where the sutures are coming off where that tissue is torn into two pieces, and that's being repaired with this technique. Overall, this is a lot more disabling than the name might indicate at turf toe, and it's something that heals relatively slow and has to be treated with patience and over adequate time period. I hope this helps you in your understanding of turf toe. This is Tom Anderson. Thank you.